Welcome to STEMTalk, where ideas ignite impact. STEMTalk is the official audio podcast series by STEMConnect Pvt Ltd, your gateway to innovation, excellence, and thought leadership in science, technology, engineering, and mathematics. Here, we bring powerful conversations, breakthrough insights, and bold voices that are shaping the future of STEM in Pakistan and beyond. Whether you're a curious learner, a seasoned professional, or an innovator at heart, this is your space to explore, engage, and be inspired.
Just staring at a mountain of research papers, articles, data, it's like information overload hits you, and you think, how on earth do I make sense of any of this? Quickly, thoroughly.
Oh, absolutely. It's a completely understandable reaction. I mean, the sheer volume of published work today is just immense. Finding that signal in the noise, getting to conclusions you can actually trust, it feels almost impossible without a really, really structured approach.
Exactly. And that structured approach, well, it often starts way before you even read the first paper. Welcome to the deep dive. This is where we take that stack of sources you've shared, the expert guides, the academic articles, library resources, and we really dig out the most important nuggets for you.
Yeah, that's the plan.
Our mission in this deep dive is to give you a really clear understanding of a critical, absolutely foundational step in navigating that information mountain, developing a robust systematic review protocol.
We want to unpack what it is, why it's so essential, and, how you actually build one, using the guidance right from the materials you sent over.
We'll be pulling insights from those practical guides on protocol development, academic papers discussing the sort of nuances of the process, and resources from places like university libraries, Cochrane, Prisma.
Think of the protocol as the detailed roadmap, right? The blueprint you create before you start your journey through all that evidence.
Okay, let's unpack this straight away then. Why? Why is writing this detailed roadmap, this protocol, so incredibly crucial before you even think about looking at the studies? It kind of feels like extra work up front.
It might feel like extra work, yeah, but the sources are incredibly clear on this. Yeah. It's absolutely fundamental to the rigor, the trustworthiness of your entire review. Probably the single biggest reason is reducing bias.
Bias. How does planning ahead, writing things down, how does that reduce bias?
Well, by pre-specifying exactly how you plan to conduct the review. I mean, exactly. Your questions, your methods, the criteria for including studies, how you'll analyze the data, you minimize that risk of unintentionally biasing your study selection. Or how you report the findings after you've already seen what the results look like. You're basically locking in your plan before you can be swayed by the findings themselves.
Ah, okay. So you're not tempted to maybe suddenly decide, this type of study should definitely be included just because its results look good.
Precisely. That's exactly it. Another huge reason is transparency and reproducibility. The protocol documents your entire strategy right there, up front.
Okay.
It lets anyone looking at your finished review see exactly what you set out to do, how you plan to do it, and understand any changes you made along the way. This level of documentation means others could potentially replicate your process. And that's foundational in research, right?
So it's like showing your work, every single step.
Exactly. And registering your protocol, which the sources really strongly recommend, adds another layer of transparency. Platforms like Prospero are really key here, especially for reviews looking at health-related outcomes, though they do cover other areas too, like education, social welfare.
Registering also helps with preventing duplication, doesn't it? You sort of put your flag in the ground saying, hey, we're doing this review, so other teams don't waste time starting the exact same project.
Absolutely. It's a vital way to coordinate research efforts. The sources also mention that registration, especially on platforms that might offer peer review of protocols, can actually increase the overall rigor and validation of your plan before you even start the heavy lifting.
And what about following established standards, like Prisma or the Cochrane Handbook?
Well, those standards, which really represent the best practices in systematic review methodology, they fundamentally require having a protocol documented up front. It's not just, good practice. It's a core component of these frameworks.
Right.
And yeah, sometimes it's simply a requirement. Funding agencies, journals, they often won't even consider your work without a pre-registered protocol.
You mentioned Prospero. Is that something anyone can just sign up for and register?
Prospero is the main one for health and related areas, yeah. Now, students typically can't register on Prospero itself unless they're part of an eligible institution's project. But and this is important, the sources really emphasize that the Prospero record structure itself is an excellent template for anyone developing a protocol.
Yeah. Okay.
Regardless of whether you can formally register it there or not. You've also got other places like the Campbell Collaboration for Social Interventions and the Joanna Briggs Institute, JBI.
That's a really good point, using Prospero as a guide, even if you can't officially register there. And if you do register, the sources stressed documenting any amendments. What does that mean?
Crucially important. Look, things might change as you go. That happens. But if you make any changes to your plan after the protocol is finalized and registered, you absolutely need to document why you made that change, be totally transparent about it, and update the registered protocol.
So transparency isn't just at the start.
No, it's throughout the entire process.
Okay, so the why is crystal clear. We're talking rigor, transparency, cutting down bias. Now, let's get into the what. What actually goes into this essential blueprint, this protocol document?
Think of it like drawing up the plans for a house. So you start with the basics, right? That's the review information section.
Like the title. Needs to be concise, summarize the scope. And the sources really push using those frameworks like PICO population, intervention, comparison, outcome, or PICO for intervention reviews. Help structure the title and, importantly, include the word protocol in the title itself.
Right. One source had a great example, something like vitamin C versus placebo for the prevention and treatment of the common cold in healthy adults, a protocol for a systematic review and meta-analysis.
Okay, let's break that down using PIO. It illustrates it perfectly.
Sure. The P is healthy adult.
Okay.
The I is vitamin C. The C is placebo. And the O is prevention and treatment of the common cold. It tells you immediately the core elements, the scope, and that crucial bit. This is the plan, not the finished review.
Simple, but really effective for clarity. What else goes in that initial information section?
Listing the author's reviewers. This is all about accountability. Who is on the team? What are their specific roles? Sources give examples like principal investigator, co-investigator, maybe a research coordinator, a statistician. Defining those responsibilities up front, make sure everyone knows their part.
Makes total sense. Everyone needs a job on the building site, right? Okay, next up is background.
This really sets the stage. Why are you even doing this review? What's the problem? What's the gap in the current knowledge that you're trying to fill? You need to clearly explain the rationale, the importance of investigating this topic systematically. It justifies the whole project.
And that background, that justification, leads directly into defining your destination, the review questions or objectives.
Exactly. These are the absolute engine of your review. They have to be clearly defined, often using PIO again, especially for intervention studies, and they must flow logically right from the background section. The main objective is usually just a concise single sentence stating what the review aims to achieve.
The sources make a good point, contrasting broad questions like, does vitamin C prevent and treat colds, with much more focused ones like, does vitamin C, specifically 500 milligrams daily, prevent and treat the common cold when compared with placebo in adults aged 65 years or older?
Yeah, and that contrast really highlights a critical decision point you have to make in the protocol, a question that's too broad. You might end up with just an unmanageable number of really diverse studies, making synthesis almost impossible.
Right.
But if it's too narrow, you risk missing relevant evidence. The question you finally land on dictates everything that follows your search, your eligibility criteria, how you extract data. It's really worth spending significant time nailing this down.
All right, roadmap drafted. Destination set. Now, how do you plan the actual journey? This is where the methods section really comes alive. And this is where it gets really interesting, I think. Detailing exactly how you'll conduct the review.
Precisely. And the first absolutely critical piece here is defining your eligibility criteria. These are your strict rules. Which studies make the cut? Which ones don't? They are just fundamental for transparency and for understanding who your final findings actually apply to.
They're basically the gatekeepers for your review, aren't they? And they directly inform your search strategy, too.
Absolutely. You need to define your study characteristics based on your PICO elements with real precision. For example, are you including studies that used any dose of vitamin C, or only specific doses? Oral administration? Intravenous? Only placebo comparisons, or maybe comparisons against standard care too? That level of detail is vital.
And specifying the study designs you'll include. Is it only randomized controlled trials, RCTs? Or maybe quasi-RCTs as well. The sources do note that, especially in complex areas, say public health, if you strictly limit yourself to RCTs, you might actually miss valuable evidence from other robust designs. But you need a clear rationale if you include them.
And here's a crucial nugget from the sources regarding eligibility. You absolutely must pre-identify your outcomes in the protocol, even if those outcomes aren't used to initially screen studies in or out.
Why is that so important?
It's a key safeguard against selective reporting bias later on. That's where, researchers might only report the outcomes that showed statistically significant or favorable results, ignoring others.
Ah, I see. So you're deciding what outcomes matter before you know what the study's actually found for those outcomes.
Exactly. You define your primary outcomes, the most critical ones for decision-making, and your secondary outcomes, which are important, but maybe not the main focus. And you need to anticipate how you'll handle outcomes that might be measured differently across studies. Can they be combined statistically, or will you have to summarize them narratively?
What about criteria based on the report itself? Things like publication year or language restrictions.
Yeah, those are report characteristics, and any limitations you impose here need careful justification right there in the protocol. Limiting by publication year, for instance, might save resources, sure, but you could miss crucial older evidence. Restricting by language is often practical, but it means potentially missing relevant non-English studies, which could introduce bias.
Or deciding on publication status like only including peer-reviewed studies. That's common, but it excludes potentially valuable gray literature conference papers, theses, reports. And that gray literature might contain negative or non-significant results that are less likely to get published in journals, leading to publication bias.
These are definitely tricky trade-offs. The protocol forces you to really think through them, state your choices, and explain why you made them right up front. And the sources are absolutely adamant. Any changes to your eligibility criteria after you start searching or screening should not be based on the results you're finding.
Makes sense.
Piloting your criteria on a small set of studies first is highly recommended. It helps ensure they're clear and that your review team can apply them consistently.
Okay, criteria are set. Now, how do you actually find the studies that meet those criteria? That brings us to the search methods.
This needs to be systematic, comprehensive, really thorough to minimize that risk of missing relevant studies. The protocol has to list all the sources you plan to search.
The sources generally recommend searching at least 2 bibliographic databases, but often you'll need more depending on the topic. For health, Medline, Central, Embase are pretty standard starting points.
Definitely. But depending on your field, you might need to add subject-specific databases, maybe Psych&Info for psychology, Sinai HL for nursing, ERIC for education, Web of Science for broader coverage. And you also need a plan for searching gray literature. Think dissertations via ProQuest, maybe reports from regulatory agencies.
Right.
And crucially, trial registries like clinicaltrials.gov or the WHO's ICTRP, these help you find ongoing or unpublished studies, which is really important for getting the full picture.
So it's about looking way beyond just the published journal articles. And how do you build the actual search queries, the strings of terms?
You typically combine keywords, the everyday terms related to your PAOCO elements, with controlled vocabulary. That means using the database's own indexing terms, like MeshH terms in PubMed or M-trees in Embase.
Why use controlled vocabulary?
Because it helps you find studies on your topic, even if the authors use different words than you might think of. It's a more systematic way to capture relevant papers.
And you use Boolean operators, right?
Yeah.
And to combine different concepts like vitamin C and common cold, or to combine similar terms like vitamin C or ascorbic acid. And maybe not to exclude things, though you have to be careful with not. Plus using truncation symbols or wildcards and phrase searching for exact terms.
Exactly right. The protocol must present the full reproducible search strategy for every single database and source you intend to use. The PRISMA 2020 update is very clear on requiring this. Documenting every step of your search process in a detailed search log is also absolutely key for reproducibility.
And what about doing a preliminary or pilot search before launching the full systematic search? Is that recommended?
Oh, highly recommended. It helps you test your search terms, see if you're pulling back relevant studies, get a feel for the likely volume of literature. It can even help you refine your research question if your initial search pulls up way too much or almost nothing.
Okay, so you've run your searches, meticulously documented them, and now you potentially have thousands, maybe tens of thousands of records. How do you possibly manage this potential sea of information? That's navigating the sea of information, selection, and data.
This is where data management and study selection, which we usually just call screening, happens. And honestly, using software is pretty much essential these days.
You mean tools like Covidence or maybe reference managers like EndNote, Zotero, Mendeley? Covidence is specifically designed for systematic reviews, isn't it? It helps with deduplication, tracking the screening.
Exactly. Handling duplicates is that first practical step. Whether it's automated by the software or requires manual checking, you need to report how many duplicates you found and removed.
Then comes the actual screening process. Typically, this involves, 2 stages?
Usually, yes. First, an initial screen of just the titles and abstracts to quickly weed out obviously irrelevant studies. Then, for anything that looks potentially relevant, you retrieve the full text article for a much more thorough assessment against your detailed eligibility criteria.
And a cornerstone of rigorous screening, according to the sources, is having 2 independent reviewers screen every single study at both the title abstract stage and the full text stage.
Yes, absolutely. That significantly reduces the chance of errors or individual bias creeping into which studies get included or excluded. And the protocol must describe how you'll resolve disagreements between those 2 reviewers. Usually it involves discussion or bringing in a third reviewer to arbitrate.
And what if you just can't find the full text for a study that looked really promising from its abstract? It happens, right?
It definitely happens. You simply document it. You need to report how many full texts you sought, but couldn't ultimately retrieve. Transparency again.
Another potential complication the sources mention. Sometimes, a single study gets reported in multiple places. Maybe there's a trial registry entry first, then a conference abstract, then finally a full journal article.
Yes. Linking multiple reports that come from the same underlying study is crucial. You have to do this to avoid accidentally counting the same participants or the same results more than once in your analysis.
How do you do that?
Well, the protocol needs to detail how you'll try to identify these linked reports. Checking author teams, study locations, trial registration numbers can help. Then you need to decide which report you'll use as the primary source for extracting data. Usually, it's the most complete publication, often the peer-reviewed journal article. It can feel a bit like detective work sometimes.
And this whole screening and selection process, all these numbers, get visually summarized in that standard diagram, the Prisma flow diagram.
Exactly. The Prisma 2020 update really emphasizes this. It's the standard figure that shows precisely how many records you identified initially, how many you screened, how many full texts you assessed for eligibility, how many studies were ultimately included, and just as importantly, how many were excluded at each stage, along with the reasons for exclusion. It's like the visual audit trail of your entire selection journey.
Okay, so you've navigated the sea, you have your final set of included studies. Now you need to pull the specific information out of them. That's data collection and management, often called data extraction.
Right. This is about systematically collecting all the relevant data points you need from each included study. Planning this step meticulously in the protocol is absolutely key for consistency and rigor. You don't want people extracting different things or interpreting fields differently.
So you define the specific data items to collect. Your PACO elements are a great guide here, aren't they? Participant characteristics, details about the intervention and comparison groups, the outcomes measured, maybe study design features, funding sources.
Exactly. The sources do caution against over-extracting, though only pull the data you actually need to answer your research question and assess the study's risk of bias. Don't collect data just in case.
And you create a standardized extraction template or form.
Essential. And just like with screening criteria, piloting the template on a few studies first is really important. It helps ensure it works properly, captures all the necessary information logically, and that everyone on the extraction team understands how to use it consistently.
And who actually does the extraction? Is it again the 2-reviewer approach?
Ideally, yes. Independent duplicate data extraction by 2 reviewers is definitely the recommended standard to minimize errors and potential bias in interpreting the study data. And again, you need a predefined process for resolving any discrepancies between the extractors.
What about when data is just missing or unclear within a study report? That must happen all the time.
It's a very common challenge. The protocol should outline how you plan to handle this. One common method is to try and contact the original study authors to request the missing information or clarification. You should document these attempts, whether successful or not.
And if you can't get the data,
then you document that it's missing. Sometimes you can use sensitivity analyses later on to explore the potential impact of that missing data on your overall findings.
Okay, so deep breath. We found the studies, filtered them rigorously, extracted the key data meticulously. Now for the moment of truth. Making sense of it all, analysis and quality assessment. How do you plan to bring it all together?
Right. The protocol needs to outline your plan for data analysis synthesis. If your included studies are similar enough in terms of PICO methodology, you might plan to conduct a quantitative synthesis using meta-analysis. That means statistically pooling the data.
And in the protocol, you'd specify the effect measures you plan to use. Things like risk ratios, odds ratios, mean differences, and the statistical models, like fixed effect versus random effects models.
Precisely. You need to state those intentions. And critically, you need a plan for how you will assess heterogeneity. That's the variability or inconsistency you see between the results of the individual studies.
How do you measure that?
Common statistics are I4, I squared, or Cochrane's Q-test. The protocol should state how you'll interpret these. If you find substantial heterogeneity, maybe a high I value, it might mean that statistically pooling the results in a meta-analysis isn't actually appropriate.
So what do you do then?
In that case, your protocol should state that you'll summarize the results narratively instead. You might also plan subgroup analyses or sensitivity analyses to try and explore the reasons for that heterogeneity. Is it because of differences in populations, intervention intensity, study quality?
And if quantitative synthesis meta-analysis isn't possible or appropriate from the start, maybe the studies are too diverse, or it's qualitative data you plan for narrative synthesis.
Exactly. Your protocol needs to describe how you will summarize the findings textually, perhaps grouping studies by key characteristics, or using tables to present the results clearly.
You'd also mention the software you plan to use for analysis, right? Like Revman from Cochrane, maybe specialist stats packages, even Excel for some aspects. And maybe noting if you need statistical advice.
Yes, absolutely. Good practice to mention the tools. And acknowledging the need for statistical expertise if the team doesn't have it is important too.
Okay, beyond just synthesizing the results, you absolutely need to assess the quality or trustworthiness of the individual studies you've included. This is the risk of bias in individual studies assessment.
This is non-negotiable. It's vital for understanding how much confidence you can place in the overall evidence. Methodological flaws in a study can significantly inflate or deflate its reported effects. So the protocol must state which validated tool you will use for this assessment.
And the sources list several common ones, depending on study design. The Cochrane-Robbie-2 tool for randomized controlled trials, Robbins-I for non-randomized studies of interventions, maybe JBI critical appraisal tools for various other designs.
Exactly. You specify the tool, and guess what? The recommendation, again, is for independent duplicate assessment by 2 reviewers, with a clear plan for resolving disagreements. Consistency is key.
And these risk of bias assessments, they don't just sit there, right? They can feed back into the analysis.
They definitely can. For example, you might plan a sensitivity analysis where you rerun your meta-analysis, including only the studies judged to be at low risk of bias, to see if the overall finding changes.
Okay, so that's bias within individual studies. What about biases that might affect the entire review's findings? The so-called meta-bias.
Good point. The protocol should acknowledge these and potentially describe how they'll be assessed. Publication bias is a major one. That tendency for studies with positive or statistically significant results to be more likely to get published than those with null or negative findings.
How can you assess that?
If you have enough studies in a meta-analysis, usually 10 or more, you might plan to visually inspect a funnel plot to look for asymmetry, which can suggest publication bias, though funnel plots have limitations.
What about selective reporting bias at the review level?
Well, that's where the protocol itself is your primary defense. By pre-specifying your outcomes of interest in your analysis plans before you see the results, you prevent yourself, the review author, from consciously or unconsciously emphasizing only the favorable outcomes from the included studies.
So the protocol protects against your own potential reporting bias.
Exactly. And you might also mention assessing funding bias in the protocol, planning to extract information on who sponsored each included study, as industry funding is often associated with results favorable to the sponsor's product.
Okay, so after assessing individual study bias and potential meta-biases, the final step in the analysis plan is often assessing the overall certainty of evidence, right?
Yes. This is about communicating how much confidence we should have in the overall body of evidence for each key outcome you've synthesized. Frameworks like the GRADE methodology are commonly used for this.
And GRADE looks at multiple factors.
Right. It considers the risk of bias across the studies, the consistency of the results, how directly the evidence addresses your PICO question, the precision of the estimate, and potential publication bias, among other things. It leads to a rating high, moderate, low, or very low certainty, which helps people using your review understand how much trust to place in the findings.
Okay, that's a comprehensive blueprint. But, life happens, research happens. Sometimes even the most meticulously laid plans need adjusting. What if things change during the actual review process?
That's a really important point, and it's why protocols usually include a section on potential protocol amendments. It acknowledges that changes can happen. Maybe you discover a new, relevant type of study design you hadn't anticipated, or realize a more precise outcome measure is consistently reported across studies.
But crucially, you can't just make these changes silently, especially after you've maybe seen some results, right?
Absolutely not. That would undermine the whole point of the protocol reducing bias. Any change from the original protocol needs a very clear rationale. Why is this change necessary? It must be fully documented, ideally with the date of the change. And importantly, if your protocol was registered, the public register record needs to be updated to reflect the amendment and the reason for it.
So transparency about changes is just as vital as transparency about the initial plan.
Precisely.
Okay, to wrap up this really detailed deep dive, the sources kind of distilled some key practical advice. Maybe we can quickly recap those top tips for anyone embarking on writing a systematic review protocol.
Yeah, good idea. First, and maybe most critical, write your protocol early. Do it before you start your systematic search. Don't search first and then write the protocol.
Got it. Second.
Use a framework like Pilaco or Pico or whatever is appropriate for your question to help you define your research question and your eligibility criteria with absolute clarity. It really is your navigational compass.
Okay, third tip.
Let the protocol explicitly guide the development of your data extraction template. Your detailed plan dictates exactly what data you need to collect, ensuring you don't waste time over-extracting irrelevant stuff, or worse, miss vital information because you hadn't planned for it.
Makes sense. And the fourth tip.
Register your protocol whenever possible, especially for reviews of interventions or health-related topics. It's really become the gold standard for transparency. It helps prevent duplication of effort, and it adds significant credibility to your review process.
And even if formal registration isn't an option, maybe for students or certain types of reviews, using the structure of a registered protocol, like the Prospero template, as your guide is still incredibly valuable advice.
Absolutely. That structure forces you to think through all the necessary components. The key message really is, plan ahead meticulously, make all your methodological decisions explicit, and document absolutely everything.
So, listening to all this, what does it really mean? Developing a systematic review protocol, it isn't just some bureaucratic step you have to tick off. It's not just paperwork. It truly is the essential foundation for conducting research that is rigorous, transparent, and reproducible.
It really is your best tool for minimizing bias, both consciously and unconsciously, and for helping you confidently find and synthesize the best available evidence on a particular topic. It forces that crucial thinking before you're potentially overwhelmed by the sheer volume of studies and their findings.
It's like drawing that detailed map of the evidence landscape before you set foot in it.
Exactly. And even when you're dealing with complex areas, maybe like public health interventions, where the studies might be really diverse, different populations, different settings, variations on the intervention, that protocol process provides the necessary structure to try and synthesize that diverse information as systematically and transparently as possible. It's all about making deliberate choices and documenting your journey.
But it's clear, building such a detailed roadmap, it takes significant time and effort up front. It forces you to make sometimes difficult decisions about scope, about criteria, often before you have the full picture of all the available literature.
That's true. It's a front-loaded process.
Which does leave us with a final, maybe provocative thought for you to consider. Given that considerable depth and rigor, that significant upfront investment required to craft such a comprehensive systematic review protocol, does that level of detailed planning always outweigh the potential need for, let's say, pragmatism and faster answers? Particularly thinking about situations like urgent public health crises, or maybe rapidly evolving fields where quick insights are desperately needed. What's the optimal balance there? How do we balance comprehensive, bias-minimizing planning with the real-world pressure to respond quickly to critical information needs?
That's a really tough question. The tension between rigor and timeliness.
It is definitely something to think about as you consider how you navigate your own information mountains.
This is the end of the current blog post of STEMTalk by STEMConnect Pvt Ltd. Thanks for tuning in to this episode. We'd love to hear your thoughts. Drop your feedback in the comments below. If you enjoyed this conversation, don't forget to subscribe to our YouTube channel for more inspiring discussions, expert insights, and powerful ideas shaping the future of science, technology, education, and innovation. Stay curious, stay connected.